A lot of Americans right now are at risk for diabetes, and a lot of people don't know that. The Durham Diabetes Coalition has several different parts involved, and the clinical team, what we're trying to do is really reach those high-risk patients with diabetes and see if we can improve their self-management, improve their diabetes, and hopefully prevent complications and prevent unwanted hospitalizations. The clinical team has 2 nurse practitioners, 2 registered dietitians, 2 licensed clinical social workers, 3 community health assistants, and a supervising physician. The nurse practitioner, dietitian, social worker, and community health assistant are involved in going to the patient's home.
I am responsible for helping the nurse practitioners, the licensed clinical social worker, and the dietitian meet the needs of our patients.
And then we're able to relate that information back to our supervising physician to make sure that the patient's getting appropriate care.
I see myself as a person that I'm doing just that, being the bridge that helps keep the patient and provider connected so that they can help provide the best care for that patient.
We're trying to reach patients that have diabetes as well as other barriers to managing their diabetes that we can hopefully intervene in their home. In the clinical team, it's important to have a nurse practitioner to be able to do home visits, because what we can do is we can do medication reconciliation, and we can review medicine, and we can also, if we need to add additional medicine that patients need, or if we need to change medicines that they're already on, we are able to work with the primary care provider and then the pharmacy and do that. Our goal is for the patient to see the nurse practitioner, the dietitian, the social worker, and the community health assistant. The reason we want them to see everyone is everyone has a little different view and they have a different focus. When they have a different focus, we're able to really see all aspects of a patient's life and where we need to, where we can have the biggest impact.
When I hear the words community health assistant, I think of being a support for those professionals that work with the DDC, and in supporting them, I can help bring the patient's view to the providers and help them to understand what the patient's needs actually are from a home standpoint.
My favorite part of being a part of the Durham Diabetes Coalition is seeing patients take control of their diabetes and have improvement. When they are able to learn something new and they're able to see the improvement and they get excited about the improvement, it makes my job much more worthwhile. We're hoping by using different members of the healthcare team, by using the dietitian, by using the social worker and the community health assistant, as well as the nurse practitioner, that we can prevent complications from diabetes, we can help the patient feel better, and that we can hopefully reduce hospitalizations that are unwanted.